Good afternoon, everyone. Thank you so much for joining us today. Before we begin, I would like to advise those participating that we will be recording today's session. Now I might just get started. Good afternoon. On behalf of Eastern Melbourne PHN, I wish to welcome everyone to Data Cleansing, a quality improvement activity to support identifying eligible patients for MyMedicare. My name is Nicole Stark and I'm the Events and Education Coordinator at EMPHN. And before we begin, I'd like to start with an acknowledgement of country. Eastern Melbourne PHN acknowledges the Wurundjeri people and other people of the Kulin Nations on whose unceded lands our work in the community takes place. EMPHN respectfully acknowledges their ancestors and elders, past and present. In the spirit of reconciliation, Eastern Melbourne PHN acknowledges the traditional custodians of country throughout Australia and their cultural, environmental, and spiritual connections to land, sea, and community. We pay our respects to their elders past and present and extend respect to all Aboriginals and Torres Strait Islander peoples today. Some quick housekeeping. All attendees will remain on mute throughout the presentation. Please type any questions for our speakers into the Q&A box at the bottom of the screen, and these will be answered at the end of the presentation. Now, that is all from me. I will now pass the mic to Ange.
Thanks, Nicole. And good afternoon, everybody, and welcome to the last of our quality improvement webinars for the year in the series that we've had this year. It's been great to see so many people attending these series across the year. And I'd also like to thank our colleagues, Julie, Barb, and Tom, who have been presenting with me in these series throughout the year. Today's session, we're going to be covering off on a few topics that will help and prepare you for your MyMedicare journey. Firstly, we're going to go through with Julie, archiving patients and provider preferences. Looking at, with Barb, we're going to go through looking at uncoded diagnosis and looking at identifying MyMedicare patients with POLAR. Also looking at how to identify those patients most at risk who may be eligible to be invited into the MyMedicare program. And finally, Tom is going to go through patient flagging with a user case scenario and actually look how that can be relative to this space in MyMedicare. So firstly, before we start today's session, we wanted to share some outstanding results with you all from our past PIP quarter. From the last sessions that we held, either our QI session or the health assessment session run by Julie, we had over 96 practices who attended those across those events. And the results are in with the health assessments. We had a really impressive increase that we could see with health assessments for patients over 75, 45 to 49-year-olds, and heart health checks. We'll be distributing achievement awards to a number of practices. So, but as a group of those 96 practices that attended those sessions, we could see that there was a 30% increase, which is an absolutely fabulous effort. So just from those 96 practices, we could see that there was originally at baseline 5,500 assessments completed. And at the end of the PIP quarter, it reached up to 7,200. So fantastic effort by everyone. Congratulations. And we saw some great results across many of the practices. So we're really pleased to see that our quality improvement events are supporting you with these activities at your practice. In relevance to today's activity back to general practice, we have put some RSCGP resources here, some quick links to some guides that might be relevant to you to have a look at to help you along with your quality improvement journey and to help you with your quality record keeping at your practice. I'd like to pass over to our first speaker today, Julie. Thanks, Julie.
Thanks, Ange. Hi, everyone. Now, having a process for inactivating patients who have not attended for a number of years are visiting patients, example, overseas or interstate relatives of regular patients, deceased or duplicate patients, is most important for effective data cleansing. Making patients inactive via a bulk inactivation process is relatively simple in both Medical Director and Praxsoft. Firstly, you should discuss the time frame you wish to use with your team. For example, you could use patients who have not attended in the last 3 to 5 years, but it's a practice by practice decision. This action does not delete the patient file. It only changes the status from active to inactive. You can also make inactive patients active again by changing the status back to active. And you can still search for inactive patients in your software by simply ticking the Include Inactive Patient option in the Patient Search feature. Please note this does not change your SWIPI calculation for PIP payment, and it will not remove patient reminders. This should be an annual task or even done more frequently. And resources on how to do this will be sent out for both MD and Praxsoft in today's presentation. Thanks, Ange. Not all diagnoses need to be saved in past history. Have a concise past history list in your patient's files to avoid having redundant data. When past medical history is not used correctly, it can result in failure to treat or follow best practice guidelines and failure to consider relevant surgical history or comorbidities. To avoid this issue, it is important to only enter chronic conditions and significant events in the past medical history. This is something you can set up using your preferences, your software's preferences, to avoid messy patient history screens that look like this. Thanks, Ange. You can see items such as medical certificate, cough, dressing change, results discussed, etc. When you upload a shared health summary or write referrals, all these past history items will be included when all we need to do is add the relevant information, which in this case is diabetes mellitus type 2, and we only need to add this once, not multiple times. Always speak with your clinicians before implementing this though, as they are the ones that need to remember to add any significant items to the past history by ticking Add to Past History when applicable. This is the same in Medical Director. Always ensure your clinicians keep the past history lists up to date and mark past history items as inactive when appropriate. I will now hand you over to Barb.
Thank you, Julie. This task, I always say this is not for the faint-hearted, and it may go into the save for later tasks. You can do this in both Medical Director and Best Practice, but the action is the same. In Medical Director, it's in Medical Director Maintenance, and in Best Practice, it's in the BP Utilities app. It's not in the main MD or BP apps. It's a job for someone with a clinical background, and depending upon how long your practice has been open and whether or not it's part of your current procedures, you may have a long list of uncoded past history items. Using the past history cleanup functionality will match an uncoded diagnosis to a coded one. You select the uncoded one from the item on the left and you replace it with a coded item from the right. If you find you've got large lists, you may need to have conversations with your GPs and nurses about using the coded lists and using the notes or comments functionality in your clinical information systems to add additional notes if needed, but it will be an ongoing task. It is an accreditation standard, 11.3. Our practice uses a nationally recognised medical vocabulary for coding. Next slide, please, Ange. Now let's look at how we can use Polar to identify patients for MyMedicare registration. Now we have nice, clean, tidy databases. We can move to this step now. So while all patients are eligible to register for MyMedicare, you may want to start with patients who have an active diagnosis of a chronic disease or patients who are at risk of a hospital stay. You can use Polar for either cohort, export the list and send out an email to patients to invite them to register. As long as you ensure you use the BCC option in your Outlook, if you're sending out a group email, or you may want to choose a more targeted approach or creating alerts in your clinical information systems for suitable patients when they're at the point of care. Next slide, please, Ange. To find patients with an active chronic disease in POLAR, open the POLAR Clinic Summary Report, select the RACGP and Practice Active shortcut, then select the diagnosis filter on the left-hand side and select Active Diagnosis and confirm the selection. Next slide, please, Ange. Select the clinical drop-down list from the top and then select diagnosis, and from the tree on the left-hand side, select the chronic disease categories and select all the items and confirm the selection. And what you've now got is a patient list with active RACGP active who have an active chronic disease. You can select the patient list up the top right-hand side and export this list to Excel to sort. You can use the patient flagging feature for this patient cohort, and Tom's going to take you through that shortly when he presents. Next slide, please, Ange. Or we can use the Hospital Avoidance Tool report, or HAT as the vendor calls it, to prioritise even further. In POLAR, we open the Hospital Avoidance Tool report tile. And if you haven't already used this report, it's relatively new. It's replacing the HARP report. I recommend you have a look at it and open the MBS tab another time. We won't be going into that today, but it's an easy report to use, and all the clinicians in your practice will love it. Next slide, please, Ange. Select the RACGP active shortcut and then select the urgent risk to start. The report will default to opening in the patient cohort tab up the top left-hand side. This will give you a list of your most at-risk patients. You can select the patient list and export the list to Excel to further sort if you wish. And then you can repeat when you're ready with the high-risk patients as well. We will have walkthroughs today for both the HAT search and the chronic disease search, which will be distributed to all attendees today. And again, you can use the patient flagging feature for this patient cohort. So I'll hand over to Tom now, who's going to guide you through how to use patient flagging.
Thanks, Barb. So patient flagging is an exciting new feature now available in POLAR. It enables practices to group cohorts of patients, such as Barb mentioned, patients residing in residential aged care homes and by aged care homes, or patients who have an active diagnosis of a chronic disease, and mark them registered when they have registered for MyMedicare. A walkthrough to set up patient flagging in a practice will be provided, and the digital health team is also happy to assist you with implementing patient flagging in your practice. Today, I will demonstrate how to create a patient flag, create flag statuses, add patients residing in residential aged care homes to our newly created flag, and then add patients to a pre-existing MyMedActive chronic disease flag. Next page, next slide, please, Ange. So the first thing we need to do is log into POLAR. On the landing page, we can navigate to the Flags heading in the top black banner and select Flags Setup. Note that this option is only available to POLAR admins. You will see the existing flags listed on this screen. To create a new flag, select the Add Flag heading on the top right-hand side. Enter a flag name such as RACH patients and a description explaining the flag. You can set a start and end date for the flag if required, but these fields are not compulsory and can be left blank. Click the blue Save button to save the flag. On this screen, we select which statuses should be available within the flag. The eligible status will be ticked by default. It can be unticked and other statuses selected. However, we do need to ensure that there is at least one status selected. We can also correct the flag name or description here if needed, or simply delete the flag using the orange delete button. For practices who have set up multi-location within your clinical information system, the Access tab will allow you to determine which site or location has access to this patient flag. To save, click the blue Save button and close the prompt. If we need to create a new flag status, navigate to the Flags heading in the top black banner, select Flags Setup, and then navigate to the Flag Statuses heading in the top right corner. You will see the available statuses listed here, and these are available to all of the flags. The statuses created by your practice can be edited by selecting the Edit button to the right of the status. To add a new status, select the Add Status heading. Enter the required name for your new status and a description. Click the blue Save button. You should now see your new status listed with the other statuses. To apply this new status to our flag, select Flags from the top right-hand side. Select the required status from the list and click on Edit to the right. Tick the new status and then click Save and close the prompt so that it is linked to the flag. Now that the patient flag is set up, we can allocate patients to the flag. Navigate to the Flags heading in the top black banner and then select Patient Flagging. Select the required flag and status. To search for our RACH patients, I will identify them by searching in the address column for the RACH address. Now only the patients at this address will be listed. We can select or deselect individual patients by ticking each box, or we can use the Select All or Select None buttons on the top right-hand side of the list to tick or untick the entire list. Use the blue Apply button to add these patients to the RACH patients flag with an eligible status and select Apply again on the prompt. I can repeat this process to add patients from another address. To see only patients in my RACH patients flag, ensure that this flag is selected and then under the flag status heading, type in the required status. You can see that now we only have the RACH eligible patients listed. To change the status of a patient, simply select the required patient or patients, navigate to the status drop-down menu and select the desired status. Click the blue Apply button and the selected patients will now have a new status of Group 1. We can also add patients to the patient flag in the clinical summary report, which I will do for our second example for flagging patients who have an active diagnosis of chronic disease and mark them registered when they have registered for MyMedicare. Navigate to the clinic summary report and apply the required filters. I'm going to apply the patient active filter, RACGP active filter, and navigate to the diagnosis page. This is the old example, Barb. Sorry, so what we're doing, this is the old video we had, but what we've done here, we've actually used the patient status and RACGP active flags. We've identified our age groups, and then we're opening the patient flagging. From here, you'll notice that it's open in a new tab. We select our RACH patients flag. We can see here that we're showing 28 patients. And if we go back to our polar, we can see that it's matching the 28 patients there as well. We select our eligible category. We've selected all of the patients. Remove any patients that we don't want included, and then select Apply to apply an eligible status to each of those patients. And Apply to confirm. There are filters in Polar for flag name and flag status. Just be aware that if you do create a new patient flag, that these may not appear in the list until 24 hours later. To delete a flag, navigate to the Flags heading and select Flag Setup. Select the required flag from the list and select the Edit button to the right. Notice that the orange Delete button wasn't displaying here. This is due to patients being allocated to this flag. The same can also occur if attempting to delete a status. If you experience this, the first thing we need to do is remove the allocated patients from the flag. Select Flags and Patient Flagging. Select the required patient flag from the drop-down list. Select all the patients in this list and then select Clear Flag option from the Select Status drop-down menu. Click the blue Apply button and then confirm the selection. Again, select Flags, Flag Setup, select the required flag, and then click the Edit button. And now you'll notice the orange Delete button is now back, which we can click, and now the flag has been deleted. So as we mentioned earlier, we do have a walkthrough to set up patient flagging available and that will be provided. And if you need any further assistance, then the digital health team are happy to assist if required. And I'll hand over to our next speaker.
Thanks, Tom. Thanks for that demonstration of flagging. And I know that for a lot of people looking at that demonstration, it can be a little bit confusing, but at the same time, the digital health team are here to support you. Obviously, we'll be sending out after the session today those resources to help step you through that, but also we do have the wonderful team here available for training now or into next year to help support with that once it becomes relevant to you in your practice. So in summary, always remember to ensure that you have a process for keeping your files up to date. Remind your clinicians to select from the coded lists, having conversations around that as a team as to how that will be undertaken. The data cleansing activities may take you several quarters. So please, as Barb said, don't feel that you have to try and do this at one session. And it does take a bit of the team to actually come together as a group to actually undertake those activities together. So consider what needs to be done first as a starting point, and then go through as to what can be done and then what can then be done as business as usual every day to make sure that your lists stay up to date. Expect to share your patient health records with other providers. So remembering what is in your software will sometimes be uploaded into your letters or correspondence. So, and obviously into shared health summaries or information going up to My Health Records. So the work that you do in your practice is not just only for your benefit and to your patients, but also other providers in your patient care. Using Polar to assist you with identifying patient cohorts for MyMedicare. We know the value of your data that can be pulled out of Polar. And as information is coming through from MyMedicare, and as we start seeing the value proposition for your patients, you'll be able to identify which patient cohorts you would like to identify first as your target patients. So please reach out to the team for helping assist if you've got an idea of patient you'd like to actually target, and they can assist you with that, that walkthrough. So as mentioned, the team here are happy to assist. If there's any questions at all, Barb, or anyone that would like to share about their journey about their previous health assessments and how they went with undertaking that and if, what worked with them, is there any questions there, Barb, that we can refer to from the group?
We don't have any questions in the Q&A yet. I just wanted to point out the patient flagging, it does seem daunting and confusing, but essentially it's just sorting patient lists and providing something that the clinical softwares don't currently allow you to do, which is to flag which patients are registered for MyMedicare or patients living in residential age care homes. So like Ange said, we're here to help with that. But no questions as yet.
No
Is there
questions
anyone that did the health assessment activity that would like to share any insights? Would be good. Does anyone? You can put some information into the Q&A. Otherwise, an early finish is a good finish.
An early finish is a great finish. So on that, we'll just keep an eye out. And if there any questions do come through from today, also the team will follow up with any inquiries or any questions that you may have as a result of this presentation. So as mentioned, for further information and support, to reach out to Barb and Tom with Polar assistance and support, please reach out to our digital health email. We're here to assist. The team are here right through to the end of the year, and we'll have somebody in the team here in through January as well. So there is support available if needed. And obviously Julie and her fabulous general practice team are here to support you with your quality improvement activities in that space as well. So please reach out to our practice support team if needed. And I'm sure there's somebody overseeing that inbox as well over the new year period as well. Finally, just please remember to fill out, if you can, the survey. You can either scan the QR code here, but it'll also pop up for you at the end of today's presentation. The team are currently planning for next year's events. We hope to continue our quarterly quality improvement events, but obviously, most importantly, we want to actually present on topics that are relevant and important to your practice. So please greatly appreciate your feedback in the survey. If you can pop your ideas in there or things that you would like to for us to capture over the next 6 to 12 months. Obviously, we'll take on that feedback as the year goes on, but we are doing that planning now. So a great opportunity for you to have feedback into there. Also, future planning for other events coming up. So please register through the QR code there on the right for any events that are coming up next year. And that's it for today. I think there has been one question that's popped up though. There we go. The team is not working between Christmas and New Year. So we do have closure from, I think it's Friday the 22nd, I think it is,
Yes.
if I'm right, Friday the
Yeah.
22nd. And we're closed through to Tuesday the 2nd of January, which I'm thinking most people will have skeleton staff at that time anyway. So from behalf of the general practice team and the digital health team and the quality improvement team, we'd like to thank you all for being in attendance today, our quality improvement sessions throughout the year. And it's not quite December yet, but I would like to wish you all a safe and finish to the end of the year and also over the festive season to you and all your practice teams. Thank you all to attending today, and we look forward to supporting you and your practices going into 2024. Fantastic. Thanks, everyone. Have a great afternoon.